Hi, everyone. Thank you for joining us today during our August Lunch and Learn. Our guest presenter today is a registered respiratory therapist and will be talking to us about asthma management.
So much for having me today. I This is a passion of mine. My mom had terrible asthma growing up as a kid, and so there is a lot of information here today that I'm sharing with you. But there are links, and you can email me after the program for any of the documents that. Do not have links attached to them, and I will provide them for you. It's really what everyone needs to know, whether you have asthma, have a child with asthma, or know someone with asthma, or just to have this knowledge is going to help our asthma individuals with asthma in the community. So thank you again for having me today. I also represent the Allergy and Asthma Network, which is a huge resource where you can get most all of this information, and I encourage you to go there and seek it out if you need. So, asthma awareness and education of healthcare workers, teachers, coaches, childcare providers, and community members is really the key to happier, healthier, more active persons with asthma. This is our program content today. I always like to say it's not rocket science because it really is not. We're going to cover a lot of ground today, so bear with me. You'll have the handout, you'll have the links, and thanks again. So, what is asthma? Asthma is a lung disease caused by increased reaction of the airways. And the airways are very tiny. And if you can see my lung model behind me, some of our airways where we take in air are as tiny as a pencil lead, right? And so the reaction of the airways to a certain stimuli can be very life threatening. And of the individuals that die every single day, 1/3 of them were diagnosed with just a mild form of asthma. Asthma is a chronic, lifelong disease. It really never, you always have it, but symptoms may come and go, and it's often related to allergies. Now, children do not usually outgrow asthma. They may be symptom free for long periods of time, but the tendency for asthma attack is always there. You know how our environments may change and things of that nature. There can be a new trigger for any individual. So, what causes asthma? Yes, there are genetic and environmental factors and family history of allergies or asthma, depending on if you have one parent, two parents. All of that increases your risk of asthma. Damage to the lung development from a premature birth or early childhood respiratory illnesses can cause asthma. Mothers smoking, of course, exposure to secondhand smoke, which is very toxic, or air pollution while they're pregnant. Early childhood exposure to secondhand smoke, air pollution, and indoor allergies also. So there's many causes of asthma. There are some common types of asthma. Seasonal makes sense, right? It's triggered by trees, grasses, flowers, or the climate even. Allergic asthma is triggered by any allergen. And with allergic asthma, you have sneezing, itchy, watery eyes, and runny nose, in addition to the lung reaction and the swelling and inflammation inside the lungs. Now, exercise induced asthma is triggered by vigorous or prolonged exercise, and this can be for a kid running amok in the playground, for an athlete that's competing, for a 60-year-old power walker, right? So it can really be triggered in anyone. And what happens is some of the common symptoms of asthma: coughing, chest tightness, wheezing, that squeaky breathing, that kind of musical breathing that you hear, and also unusual fatigue and shortness of breath. Now, for exercise induced asthma, it can be managed very, very easily by taking your medication 15 to 20 minutes prior to exercise. And that's going to be your rescue medication that you will take. So that sets up your lungs to be able to compete and do whatever exercise that you wish. Now, it's good to wrap our heads around asthma and the problem in our country. There's 25 million individuals that have asthma. 1 in 10 children. It's very expensive as far as healthcare dollars go. There are over 3,000 deaths each and every year. There are 13.8 million missed school days per year and 14.2 million missed work days. So see the impact that it has on not only the individual with asthma, but the parent or the caregiver. 3 in 5 people say that asthma limits their physical activities, the things that they love to do. And 71%, this makes respiratory therapists' heads explode, they don't use their medications properly. And we're going to go over that today. 1 in 5 individuals cannot afford to even have their medications, and inhalers are particularly expensive. The highest asthma rates in the US are with persons on Medicaid and also living below the poverty level. And one more thing, more boys than girls have asthma, but more women than men have asthma, kind of flipped around when you get older. So, according to the American Lung Association, there are asthma disparities. And we know for any individual with a chronic lung disease or many types of diseases, there are disparities for certain populations. Those that don't have access to health care, those that have low income, or are exposed to environmental allergens and irritants. If there is educational inequality for individuals, and also when there's language and cultural differences, this causes asthma to be more prevalent in certain populations. Asthma cannot be cured, but it can be controlled, and it can be controlled very, very easily. The key points we're going to cover: what you need to know, how to recognize asthma symptoms, what's happening during an asthma attack, and the role of inflammation, and also the difference between rescue and controller medication. That seems to be a big problem with individuals understanding which medication to take and when. So, common asthma symptoms: coughing, that chest tightness, that heaviness in your chest, shortness of breath, fatigue, and wheezing, that squeaky breathing. So, what's happening during an asthma attack? The airways of the lung become narrow and obstructed. There's also constriction of little tiny muscles that are surrounding all of those little delicate airways. They squeeze and narrow the airways shut. And then secretions also build up and mucus production inside the airway. So it's just a triple threat when there is an asthma attack occurring. So, understanding inflammation. There's quiet asthma when there's inflammation and swelling, but the individual, you can't hear it, or you can't see really what's happening. Noisy asthma is when there's an irritation that triggers breathing problems, and you have overt, coughing, wheezing, shortness of breath. So here is the difference between rescue and controller medications. Very important. So rescue, this is used to reverse asthma symptoms right now when you're having them. Immediately, it gives quick relief. Controller medication are used for long-term daily control of individuals that have persistent asthma. So it's always there. It's really a problem. We need to take that controller all the time so that you don't have flare-ups. Oftentimes there is a steroid or an anti-inflammatory inhaler or pills that may be prescribed for the controller asthma medication. So the rules of two: sometimes individuals need more than just a quick relief or that rescue inhaler when they have symptoms, right? And when a controller medication is needed is if you are taking or giving to a child, for example, the rescue inhaler more than 2 times per week. If you or perhaps your child is awakening at night with asthma symptoms more than 2 times per month, for example, coughing at night. Have you refilled your rescue inhaler or the one of your child more than 2 times per year? So if any of these are true, a controller anti-inflammatory medication may be needed. And that is when you need to talk to your healthcare provider. So it's a good rule of thumb for uh, assessing whether or not you might not be in control of your asthma. Now, individuals with exercise-induced asthma, that rescue inhaler, they take that before every time before they exercise, and that's fine because all they need is the rescue inhaler. They don't need that anti-inflammatory controller. They just need it for their exercise. Keep that in mind. So here is a is a document of respiratory treatments, and look at all the different ones. There's rescue, controller, and then there's some that does both. Now, it's important that you identify and understand which is rescue and which is controller for you or your child. For example, mark the inhalers with a sticker or a marker to identify which is which. Not knowing can lead to misuse and poor asthma control. I can't tell you how many times I've visited with families and so forth in the community where they don't know which is which and they're taking the rescue inhaler all the time and not the controller. So, very important. Now, for medications, there are medication assistance programs. You can shop around on your own, call pharmacy to pharmacy, or you to compare prices, or you can go to GoodRx at this website, and there's also a phone app available. So easy. You just type in the medicine that your doctor's prescribed, and you'll be alerted to where it is the most inexpensive. There's also medicine assistance tool, and that's a great website. And then Needy Meds. So just know that there's assistance out there. Remember, I mentioned inhalers are very expensive. So, what are the skills we need to know in asthma management? Taking or delivering medications correctly, including inhalers with spacers and nebulizers, monitoring symptoms and assessing asthma control, using a written asthma action plan, recognizing the warning signs of an asthma attack, and identifying and avoiding asthma triggers. And we're going to get into all of this, albeit at a rather brisk pace. I need lots more time with you. The greatest benefit has been found when there is a written asthma action plan and when that is used. So, how to take a meter dose inhaler? This is very important. Meter dose inhalers always use a spacer or a valve holding chamber. I guess I'm not sure if you're able to see this because I can't see myself. The What happens is this delivers the medication more effectively and safely. And you know, when you have an inhaler and you depress it and you activate it, that medicine, the whole dose comes out very turbulently, very fast. And if you take it without a spacer, then you're mostly going to get it on the back of your throat and not in your mouth and not in your lungs where it belongs. Using the spacer helps to slow all of those molecules down, the whole dose, so that when you take in your breath, you are going to get the most medication and it'll be much more effective. So you're going to sit up or stand, you're going to shake it really, really well before you use it. Exhale, place it in your mouth or over your mouth in the case of our little one there, and then activate the dose. Then you inhale slowly and deeply, hold your breath up to 10 seconds if you can, and then wait a minute between doses. If a steroid or there's a steroid component, you rinse and spit afterwards because that can give you a yeast or thrush infection in your mouth. And also, just if you're in doubt, always talk to your healthcare provider. But here are the steps to taking it properly. Now, how about how to take a dry powder inhaler? You're going to sit up or stand always when you're taking breathing treatments. Load the dose of medication. So the medication is in a little round container, or different types of containers. You generally open it, and then there is a lever to cock it and to puncture the little capsule that's inside. You're going to hold the device level and exhale completely, and then put it in your mouth. Now, here, with these types of dry powder inhalers, you inhale quickly and deeply, not slow and deep, and also hold your breath 5 to 10 seconds. Now, you don't want to exhale in the dry powder inhaler, shake it, or wash it. And if there's a steroid medicine, what do? We rinse and we spit. What about a nebulizer treatment? Nebulizer treatments are often the case with children and infants. They're prescribed by the physician, but more and more physicians are prescribing inhalers, like you saw our little toddler there with a mask attached to his spacer or his valve holding chamber. But when you take a nebulizer treatment, again, sitting upright, taking slow, deep breaths, watch the medicine appear or disappear when you're breathing it. Using a mask, if you use a mask, encourage slow, deep breaths. Now, the best way to take a nebulizer treatment is like the woman pictured here with the mouthpiece. Even children can do this. So when you have it in your mouth, you're going to breathe in and keep your lips tight, and you'll watch the medicine disappear. And when you breathe in and then exhale, the mist will come out. That's the way you know that they're taking the medicine in their mouths, because kids and older people sometimes will just breathe through their nose with it in their mouth. So that is the very best way, because the mask is just blowing the medicine in your face. So slow, deep breaths, whether mouthpiece or mask, properly clean the equipment, take it apart. You can rinse it. All of the pieces come apart very easily. Soak it in vinegar water once a week and air dry. And there's lots of portable nebulizer machines, little ones that fit in your purse. And these are particularly covered well by insurances. Now, here is a document that I will send you at your request. It is how we assess asthma control at home. So imagine if you're a parent or you're a grandma taking care of your grandchild, and the child is exhibiting some kind of symptoms. This is a test for 4 to 11 years old, and it's a very easy tool to help know if a child's asthma may not be well controlled. Now, the child will answer the first 4 questions. It's very easy. There's little pictures of their faces on how are they doing today? Are they able to play like they normally do? Very basic questions. Then the parents answer the rest. Now, no matter what the score is, this should be shared information with your healthcare provider. So call the doctor, let them know this is where the child is at, and especially if you have a concern. Some of the questions are things like, do you cough because of your asthma? How much of a problem is your asthma when you run or play? Here is the asthma control test for 12 years of age and older. Now, this is an easy tool to help a person, even a child, know if their asthma may not be well controlled. And all of the questions are answered by the person with asthma. No matter what the score, again, share this with your provider. Now, the asthma action plan, it tells you what medicines to take, when to take them, how much to take, and when to get help. Now, the asthma action plan in the community I came from, the public school system, required an asthma action plan from any parent of a child that has asthma. I even got the parochial schools to get involved and have the asthma action plan and request that. Now, remember, it should be shared with your child's coaches, their teachers. Let them know you have the asthma action plan, and make sure that you have it in place. Now, it is completed by your healthcare professional and should be updated every 3 to 6 months. Here is a picture of the front of an asthma action plan based on the symptoms or peak flow meter if used. There is a little tool called a peak flow meter that can be used with the asthma action plan to assess how a child or an individual is doing. The asthma action plan on the flip side has a controlling triggers information, and that's very helpful. So the peak flow monitor is a tool that can be used with the asthma action plan to assess control at home, at school, or during sports. There's 3 different types that you can see pictured here. It measures the amount and speed of the air that you blow out from the lungs after you take your deepest breath. Now, how do you perform a peak flow? You set the movable arrow indicator to 0. So every one of them will have an indicator that goes to 0. Stand up and take your deepest breath. Place the mouthpiece in your mouth. Close your lips tight. Make sure your tongue isn't in the way. And then blow out hard and fast as possible. Like that. Okay? It's not a long, slow, hard, fast breath, right? As fast as you can. Then you repeat it about 3 times and you document your best effort. Now, the personal best peak flow is when you take your personal best or you take your peak flow reading when you are feeling your best or you're free of asthma symptoms. So, not when you're sick. You take your readings when you wake up and when you go to sleep for a few days. You take additional readings before and after you take your medications. Calculate your red, yellow, and green zones from there. Your healthcare provider can help you. So now on the peak flow meter that I just showed you, there's markers there. So you are going to calculate your red, yellow, and green zones here on the meter itself. So if you are in your green zone, let's say, for example, your personal best is 300, right? Your green zone is 80 to 100% of your ideal number. That means it's all clear for you, right? Even if you take a controller medication, your green zone and your when you're feeling your best, your peak flow is 300. That's all clear. So you just take your medicine as scheduled, right? Now the yellow zone. That's 50 to 79% of your ideal number. So that's going to say to you, okay, this is caution. Follow your plan or call your doctor, whatever the action plan says. And the red zone is less than 50% of the ideal number. So if your ideal number is 300 and you're blowing 150, that is a definitely a medical alert. Take your rescue medication and call your doctor or 911, whatever your action plan says to do. So, what are the early warning signs of an asthma attack? Coughing, chest is hurting, wheezing, of course. It can even be changes in behavior, unusually tired, not wanting to play, restless, trouble sleeping. Rescue medication causes no improvement if that should occur, and exposure to a known trigger that results in symptoms. So you know that someone was exposed to chalk dust or mowed grass or something like that, and they're having the signs and symptoms. So this is the early warning signs. How do you handle an asthma attack? You stop the activity. You remain calm and reassure that person. You don't leave them alone. You follow the asthma action plan if you've got one handy, administer rescue medication, look for improvement, and then watch for the late warning signs. The asthma action plan should be obtained before the sporting season begins, before school starts, and make sure that everything is up to date. So, what are the late warning signs? What if you come upon a child and any of these things are happening? Call 911 if you are not sure what to do. If there is blueness of the lips or the nail beds. Now, in persons of color, it's difficult to see that blueness of the lips and the nail beds. And so you can easily look inside the mouth at the oral cavity, and you can also see this blueness manifest itself on the potty area of a child, right? For a person of color. Now, if a person is unable to walk, talk, or take a drink of water, that is a 911 call. If they're struggling to breathe and their chest and their neck muscles are working hard, if the chest on a toddler or infant is sucking in, and if breathing does not improve or is worse after you give the treatment, any of these symptoms are a call to 911. So, how to avoid the September asthma peak? Now, this is true. The asthma attacks for individuals, for children, occur during the first and the middle weeks of September. Now, this is a particular document. You can get this at the Allergy and Asthma Network. I can also send it to you by your request after the program, but it tells you things like, why does this happen? Right? It happens because kids are back in school and they're all around each other and there's all this new bacteria. It happens because in the fall there's grasses and mold and things like that in the environment. It happens because parents maybe didn't keep their child on their controller medication in the summer and now it's causing problems. So there are a lot of hospitalizations. 25% of hospitalizations of all children occur in September. Gosh, and there's so many more statistics that this will share with you. And it also has how to be proactive and prevent this from happening to you or your child. So know your triggers. Knowledge is power. So we're going to fly through the triggers here. And some of the basic management of triggers. Here's a list of asthma triggers. My mother had just about every single allergy. The only thing that she didn't trigger her asthma were things like extreme emotional expression, stress, anxiety, anger, crying, even prolonged coughing, sneezing, yelling can trigger some people's asthma. So check out this list and think about what you have in your environment, whether at home or at school. So, how do we reduce asthma triggers? Animal dander, for example, or dried saliva from kitty cats keeping furred or feathered pets out of the home, keep them out of the sleeping areas of a child or an individual, and keep the door closed, cover air vents with heavy material, and remove carpets and furniture with cloth coverings. Dust mites are a crazy, evil looking creature, but that you can't see them. So, how do you prevent dust mites? You encase mattresses and pillows in a dust-proof cover. You wash your bed linens. You must in hot water or cold water with bleach weekly. That's the only way to get rid of dust mites, which can be very problematic for individuals. Reduce the humidity to less than 60% if you can do that in your home. Remove carpets from bedrooms because that's where those dust mites can grow and proliferate. Keep stuffed toys out of bed and wash or freeze weekly. 8 to 10 hours in the freezer will kill any dust mites. And also change your pillowcase every night. Cockroaches and mice poop, and that's the problem. So keep food and garbage in closed containers. If you use baits or poisons, keep them away from pets and kids. And if you do use a spray, stay out of the room until the odor clears. And that's whether you have asthma or not. Indoor mold is very sneaky, right? You sometimes don't see it. It can be up at the light in the shower or down by the drain or under the wallpaper on the baseboards or under the vanity or anywhere of that nature, and you may not see that it's occurring. So cleaning those surfaces, fixing those leaky faucets pipes with bleach cleaners or non-toxic cleaners, like vinegar and baking soda, that's my favorite. Make sure that you do those interventions for mold. Now, pollen and outdoor mold, this is where we try to keep the windows closed and stay indoors with windows closed from late morning to afternoon in the spring and late afternoon in the fall. That's because that's when the highest pollen count is. And you might not know that. It's usually not on, unless it's a high alert, you may not hear it on the news, but you could go to your local news weather website and they will let you know. Taking a shower, a bath, or shampoo before bed. And if you have a bed partner, they should shower too, because you're bringing all that pollen in. And then begin your controller medication before your allergy season starts. So maybe you're fine in the winter, but once spring hits, you need that controller. So start it before the first blooms of spring. Tobacco smoke. If you smoke, ask your doctor about ways to quit. Ask family members to quit too. Do not allow smoking in your home or car. Secondhand smoke, it's incredibly toxic. You're not breathing in the secondhand smoke through a filter like the person that's smoking is, and not that it's going to help them very much. Third hand smoke is that heavy odor that you have on your clothing and curtains and furniture. It's also very harmful and can be very triggering. Also, smoke, strong odors, and sprays. Try not to use wood burning stoves, fireplaces, or kerosene heaters if they're a problem. And stay away from those strong odors and sprays. Could be chemical sprays, could be cleaning sprays, perfumes, things of that nature. There's sulfites in foods and beverages. Avoiding dried fruit and processed potatoes, like the ones, the scallopy potatoes you put in the oven with a little milk or butter or whatever, those have a lot of sulfites in them. And so does shrimp, and they could cause asthma symptoms. Cold air also, so cover your nose and mouth with a scarf to help prevent that. Vacuum cleaning, if you have asthma, try to get someone else to vacuum for you once or twice a week. But if you must, you could wear a mask, a face mask to help, a dust-proof mask. And you should always stay out of rooms during vacuuming and for a short while after, because you know how when you vacuum, it kicks up all of extra dust and pollen or animal dander, whatever is in the room. So always let that clear and settle until that individual with asthma comes back in the room. If you vacuum, you can use a dust mask, like I mentioned, a double layered or microfiltered vacuum bag. Those come with vacuum cleaners now, and some have a HEPA filter, a high efficiency filter. Now here, this is a great document that I'm happy to share with you per your request. It's an asthma and keeping your environment asthma friendly. And this helps helps you be a detective in your home, at school, and play. So it helps to find and fix what can make asthma worse. And there's so many great resources available here. So now I think I've come in on time or close to it. Here are your quick links and videos. They all should be working fine. Let Catherine know if something's up and she'll contact me. I want you to uh, contact me, contact Catherine. We will get you taken care of. So everyone should live happy, healthy, physically active lives without asthma symptoms slowing them down. So please reach out. And I thank you for your time today.